One of the most rewarding things about being an orthodontist is how we can change people's lives. It's amazing. Patients come in for a first exam, and they come in, and often they cover their mouth when they're talking, and they're not smiling, and they look down, and it's because self-esteem is so low because of the way the teeth look. And when the braces are removed, the difference is amazing in terms of their smile, how they feel about themselves, the way they talk, and how they perceive themselves with other people. Beautiful, healthy smiles are the most obvious benefit of orthodontic treatment. However, another outcome that is less evident is how orthodontics improves patient self-esteem. It helps adults, it helps children, and it drastically can change the way that people see themselves and help them in their either daily, professional, or school life. Beautiful, healthy smiles are the most obvious benefit of orthodontic treatment. Another outcome is increased self-confidence, but that may be less evident. But orthodontics can be credited for a dramatic improvement in careers and relationships of millions of people throughout the United States and Canada, according to the American Association of Orthodontics. With self-esteem, if patients start treatment early as children or adolescents, they may not have to suffer years of embarrassment due to self-esteem. Unfortunately, bullying is endemic among school children, and the effects can be devastating and long-lasting. The persistently bullied kid shows a definite psychological type with poorly developed social skills and a submissive nature. Physical appearance acts as a major role in bullying. Teasing related to dental appearance is very harmful. Fortunately, there is evidence of marked increase in self-confidence following early orthodontic treatment in youngsters. During 1889 and 1990, a research aimed to examine the motives why parents and third-grade school children seek orthodontic treatment was performed. And these researchers inquired the parents of 473 kids in the study to complete the self-report forms. The form had questions about their children's dental and facial appearance. It also asked questions about the reasons for seeking orthodontic treatment early for their children, and almost all parents asserted that deep concern about their children's deficient dental appearance. About half of the parents informed their children had been cruelly taunted, and 14% of the parents also reported that it was the children who actually had first sensed the need for orthodontic treatment. The main reason for parents seeking early orthodontic treatment is the unpleasant appearance of the teeth. Other reasons comprise dentist recommendations as a result of a poor facial profile. Of these, the dental overjet, which means how much the upper front teeth overlap horizontally in relation to the lower teeth, is one of the main reasons why to get treatment started, and one of the main reasons why kids get bullied in school. These are the kids that they have bucked teeth, and it actually makes a big difference in terms of finishing the treatment at an early age and correcting the problem before it becomes too severe to correct later and surgery needed to be able to fix that. Self-esteem also in adults has an important role in the workplace. People that have nice straight teeth and a nice smile have a much better chance of actually landing a job when they're seeking for a job than people that have crooked teeth, mainly because the way they show themselves and the way they relate with the people that are doing their interviews. Studies have shown that this is to be correct. In fact, I read an article about a reverend that had very, very bad teeth, and even though he was a very good public speaker, he couldn't get the message across to his congregation, and he even once heard kids in the congregation making fun of his teeth. That's when he decided to actually get orthodontic treatment, and his life has changed completely since then. He gets his message across, and he feels very confident about himself. There also have been other studies, mainly in the UK, which indicate that orthodontic treatment does not improve self-esteem, and the people that didn't have orthodontic treatment are not any happier than people that actually had orthodontic treatment. However, I beg to differ from personal experience and seeing what we see in our office. It actually changes the self-esteem greatly, I believe, and maybe because in the UK they don't care as much about their teeth. That may be a reason why. However, in summary, beautiful, healthy teeth will actually improve one's self-esteem. And braces not only change the looks, they can also change the outlook as well.